Veins are part of circulation. They're part two. Part one is actually what the arteries do. So arteries bring fresh blood from your heart around the body, and then veins return it back to the heart. So leg veins actually have a lot of work to do because they're always going against gravity, and they don't have a heart beating behind them, and they don't have the muscle in the walls like the arteries do. And so they rely on the leg veins rely on your leg muscles to pump the blood back up to your heart, especially your calf muscle. And so the more fit you are, the better your veins work. The more slim you are, the better your veins work, because your muscles are better able to pump that blood back up inside the vein. So you might think, okay, what happens when I'm standing still? I'm not contracting those muscles. Does that blood inside my veins fall back down again? But it actually doesn't, because we were made with valves inside our veins. And they're like trap doors. They open and close, and they should only allow one-way flow. So a varicose vein is very simply the fact that your valves aren't closing properly, and you've either inherited this, or hormonal influences, or an injury that has damaged the valves somehow, and they're letting backflow happen inside the veins. So this is a picture of a varicose vein with a faulty valve, and as you can see, the blood flow in a vein should only be going upwards, up out of our legs back to the heart, but in a varicose vein in our legs, it's going down as well. And the majority of the blood is going down within that vein. And so you get sort of a pooling of the blood. It just sort of sits in there. And so that whole vein starts to stretch. It gets wider and wider so that none of the valves inside it can reach each other anymore, and so you're getting constant backflow. And so you end up seeing bulges on the surface of the skin, and if it happens for long enough, that vein will never recover. Even if you remove the pressure from the faulty valve, that vein is now stretched beyond repair. It's like an elastic that when you've pulled it so much, it can't recoil, and so it's stuck like that. Another important thing I think it's important for you to understand would be the different roles with arteries and veins. And when you have a family history of heart attacks, strokes, and aneurysms, that's more of an arterial problem. And so veins, even though they're closely linked in circulation, a problem in the arteries doesn't generally get into a problem in the veins, and a problem in the veins doesn't generally get into the arteries. So you don't have to worry about that as part of your varicose vein problem. So what can we do about these veins, and is it safe to do it? We've got two vein systems in our legs. We have a deep vein system, and it does over 90% of the work, and it's illustrated by this lighter blue pipe up the middle. It's very deep within our muscles, and if you've never had a history of a blood clot or anything like that, it's going to be working properly and will never become varicose just because of the muscle support it has. Now these superficial veins, they're the ones that bother us, and together they're doing less than 10% of the work in your legs as far as returning blood to the heart from the leg. And so it's safe to remove them somehow if they're not working properly. And the two main superficial veins that tend to go wrong that we often have to fix would be the great saphenous vein, and it collects itself in your ankle and goes up the inside of your leg and joins with the deep system at the top. And then the small saphenous vein, which is at the back of your leg and joins up behind the knee with the deep system. Now there are bridging veins between both superficial veins and deep system all the way up, called perforators, but the main connection to the deep system is at the top. And often a place where they go wrong is where the valve at the top is not doing its job. It's not holding the blood where it is, and so it's letting backflow happen. So you might think, well, if my problem is largely at the top, why do I see these bulges behind or below my knee? And the reason for that is that's where the branches of that vein become more superficial, and also because of gravity. So you get problems in the ankle with the skin changing down there and the bulges around the knee, even though your problem started much higher up. And so what we can do about that, very simply, starting conservatively, we can give you compression stockings. And those would give the varicose vein wall support so that the valves that couldn't reach each other, the leaflets couldn't reach each other before, and now they can with the stocking. So that makes your leg feel a lot better, but unfortunately it's not fixing anything. So then we can talk about the ways to actually treat them. So there's three main ways of treating varicose veins. There's injections or sclerotherapy, and that's where we use a medication that we inject directly into the varicose vein, and that medication acts to dry it up, and then your body will assimilate that vein. And it's a slow process, but you feel symptomatic relief quite soon after the treatment, within that week. As far as the cosmetic part of it, it takes many months before the vein is completely assimilated. Besides the sclerotherapy, we've got surgical methods involving various things like stripping. You've probably heard of that before. That's an old technique where they actually pull the vein out of your leg in the hospital. And then we've got the endovenous laser treatment, which is the newest treatment out there, but it has been around for around 10 or 11 years, and it is proving to be the most effective and the most slick as far as treatments go out there. If you don't have your veins fixed, it's not a matter of life and death, and it's not a matter of losing your leg, but it is a matter of your symptoms, if you have them, quite likely getting worse, or if you don't have them, developing symptoms. And one way you can help with symptoms is to keep fit and to wear stockings. The other concern, if you don't have your veins treated, is very long term down the road you could end up with ulceration in the ankle area especially, and the reason for that is that area is very vulnerable because of gravity. Even though your problem is higher up, the ankle is where you'll get the skin changes. So you have to be very careful, especially if you notice you're getting an eczema patch down there and it's very itchy. Be careful not to scratch it and open anything up, because it won't heal very well until you've fixed your varicose veins. So varicose veins, one thing that's important to know when you're having them treated is it's a chronic problem. We're not curing anybody. We can't adjust your genetics to change your tendency to make them. So all we can do is help you maintain them. And we are working with a three-dimensional structure while we're working on the surface. We can't always control what's going on underneath. So it is a process you need to have done every couple of years or so, or possibly every year. Otherwise your legs will slowly deteriorate again.